Arjun, you've launched AstutePlus. Can you tell me about it?
Certainly, Ollie. So thank you for joining us today. AstutePlus is a new development based off our old Astute technology, where we get all the benefits of Astute plus a little bit more. So what we are known for is being the highest antithrombogenic coating, highest efficacy and most effective antithrombogenic coating in the world. And what that means is we can prevent clots better than anyone else. With that, whilst we're able to ensure that the blood does not clot and we actually deactivate the blood, we have all the other benefits of being a localized system. So that's really safe for the patient, which means that none of the drugs or anything within the coating are actually flowing through the body of the patient. It also means that we can sustain our efficacy for decades at a time. Our most recent results show that we can maintain our efficacy for over 30 years, and that means we can actually place implants for the lifetime of a patient. Now, what we've done in addition to all of that is when you see blood clotting on some of these long-term devices, such as hemodialysis catheters or CVC catheters, is you actually get what's called a fibrin sheath forming on the surface of the device. This is a fibrous material that is naturally created by the responses of the body, and what that ends up doing is actually growing over the device itself, causes blockages. It actually can cause the device to stick to some of the arterial walls, and right now as we see it, there are no solutions today. Usually these patients with these implants undergo drastic pharmaceutical regimes, so they're on blood thinners. There are some fibrin inhibitors out there, but with some of the clinicians that we're working with, they've actually stated that these pharmaceutical solutions aren't really working to prevent the fibrin sheath. So even though they're on all of these drugs, which bring numerous complications themselves, they're still having to find a way to prevent a fibrin sheath. Now that can mean actually taking the device out, stripping the fibrin sheath physically off the device, and then having to re-implant it. There are some other solutions there where they try and strip it from within inside the body, but these are all quite impactful to the patient. They increase the risk of the patient. So what they're looking for is something that can completely prevent the fibrin sheath from forming anyways. So what we've seen in some of the literature that we've reviewed is devices like CVC catheters fail to about 75%. There's about a 75% failure rate of the CVC catheters because of fibrin sheath alone. So that's a very, very high failure rate for one particular problem. And as we've mentioned, there aren't many sound solutions out there. So with AstutePlus, we're now offering the ability to prevent clots, deactivate the blood, prevent a fibrin sheath, ensure that nothing grows on the outside of the device at all, also ensure that we can maintain that efficacy as long as we need. So if we need to put something in a patient for years or decades at a time, we're comfortable with doing that now because of this new AstutePlus solution.